So, Dr. Ross, can you tell us a little bit about yourself and the work that you do?
Yes, I'm a physician who specializes in treating eating disorders and addictions. I'm board certified in addiction medicine, and I've recently, in the past 4 years, been one of the principals and co-founders of the Institute for Antiracism and Equity, and we do DEI consulting work.
Excellent. So, as you know, NAATP is bringing forward our DEI consultants and our membership. So, I'm just curious from your perspective, why do you think the addiction and recovery field need DEI consulting services?
I think it's really important because as time goes on, more and more treatment centers will see Black, Indigenous, and people of color in their patient population. And I think there's a lack of understanding of how maybe substance use disorders are different in that population, or how they may affect people differently, and what some of the underlying causes are. So I think it's really important. We're seeing it happen already in the eating disorder world. And there have been instances where, patients of color have felt othered, or have felt as if they have been treated in a kind of racist way. And so I think that's going to happen more and more frequently, and I think we need to be prepared for it. Our industry is huge, and this is an opportunity, which I think NAATP has already seen and is leading the way. This is an opportunity for us to kind of get ahead of the game instead of waiting until we're forced to do something.
Mm-hmm. Great. So, what makes your approach to DEI consulting unique?
I think it's not so much the approach as the people involved. In the Institute for Antiracism and Equity, there's myself, I'm a medical doctor, and then we have two PhD psychologists, and also a woman who has a PhD in social work. Two of them come from an extensive background of, counseling on large campuses, university campuses. And so we have a number of skill sets that are brought together, but I think you can characterize those by saying that we all have an extremely deep clinical knowledge about substance use disorders. And I think that gives us an edge when we're talking with or doing trainings for clinicians or even support staff. We know how treatment centers work. I was the head of the dual diagnosis eating disorder and addiction program at Sierra Tucson, and I've done consulting work at a number of other treatment facilities. So that knowledge base gives us a different, I think, view of the situation, and enables us to, I think, be more able to guide clinicians during our trainings.
Great.
Clinicians and leaders. Let me just say one other thing, Annie, and that is that we also have an approach of not just talking to people or giving lectures during trainings, but we really do have a seminar approach where we do not just teaching, not just didactic teaching, but actually interacting with the people that we're working with. And I think that gives them a chance to kind of, deal with some of their own insecurities, learn a new language around this subject matter, and really interact with experts in a way that's helpful for them.
Great. So, you spoke to this a bit, but who do you generally work with for consulting, and what do you do?
We've had a wide array of people who've come to us for consulting, everyone from public defender's office in Maricopa County, Arizona, which was really interesting. And their particular public defenders worked with people who had substance use disorders and other mental illness issues. So that was fascinating work to do. We've also done a number of facility trainings with multi-site eating disorder programs, and also with organizations. So we've had kind of a wide range of people that we've worked with.
Great. And can you tell us an example of some of this work that you've done in the past?
Well, I gave you the example of the public defenders, and I can also give a little bit more information about the multi-site treatment facility. That one we had over, I think, 150 participants that we did a training. It's been about a year and a half now ago, and we worked with everyone from the head of the clinical, clinical department to people who were support staff. And I think that what was so interesting there was both being able to blend all of those groups. I mean, some people feel like, oh, leaders should only be in leadership training, support staff should only be by themselves in training. And we found that there was a rich array of insights that were gained when those groups were combined for the trainings. And being in multi-site, some of them in the Deep South in particular, there were other issues that came up that maybe we wouldn't see if we were working in a facility in California, or the West Coast. Anyway, I think our experience has been that people want to learn this, and even if they've been taught or raised in a way that we would consider racist, many of them, when they're in the training, realize that and have insights that, that they don't want to continue along that road. And so I think it's been really exciting to work with, particularly with treatment facilities, to see those changes and how it impacts their clinical care.
Excellent. Well, thank you so much, Dr. Ross. It was a pleasure.
Thanks, Annie.